Diabetes was once a disease. It wasn't fully understood many years ago, and it caused a lot of deaths, but now that we've got advanced technology with our medications and just our research, it's helped out a lot. We can treat, manage it, and it helps people live a longer, healthier life. Almost 21 million people in the U.S. Have been diagnosed with diabetes mellitus. That's according to the Center for Disease Control, 2005. In 2000, worldwide, 171 million people were diagnosed. By the year 2030, it's expected to be 366 million people. The economic costs related to diabetes are astounding. In 2005, according to the Center for Disease Control, it was $132 billion annually. Very, very expensive disease. It's estimated to increase to $156 billion by this year and $192 billion by the year 2020. To be able to understand diabetes, you have to understand the pathophysiology. It is actually an endocrine function disorder of the pancreas. The pancreas secretes insulin, and that insulin transports the glucose that we take in by mouth, transports that to our cells for storage and for energy use. We have two types of diabetes. Type 1 is characterized by destruction of the pancreatic beta cells, and that's either by genetics or possibly environmental factors, but more than likely it's going to be by genetics that causes that. They used to call it juvenile diabetes, but now it's type 1. And that's because it commonly develops within childhood, the first 14 to 20 years of life, but it can occur at any age. Type 2 is an insulin resistance. It's also impaired insulin secretion. Both are thought to be genetically linked, but other factors can trigger your type 2 diabetes. Your risk factors for diabetes is family history, your parents or your siblings that have diabetes, obesity, greater than 20% of your desired body weight, race, ethnicity, African Americans, your Hispanic Americans, your Native Americans are at higher risk of developing the disease. Your age, if you're greater than 45 years old, puts you at a higher risk. Hypertension, which is high blood pressure, which is classified as 140 over 90. If that's sustained for a long period of time, that puts you at greater risk. Your cholesterol, your overall cholesterol level, if it's greater than 250 for a sustained period of time, we'd like to see it at 200 or less is a healthy cholesterol level. History of gestational diabetes is another big one, or delivery of babies over 9 pounds. Now we'll talk about the management a little bit of diabetes. There's 4 subcategories. I'm just going to hit a few high points on each one of them. We've got nutritional therapy, exercise, pharmacological therapy, and education. The most important objective in the dietary and nutritional management of diabetes are control of caloric intake. That way we can attain and maintain a reasonable body weight, control blood glucose levels, normalization of lipids and blood pressure, and hopefully we can prevent heart disease. We calculate a person's energy needs and caloric requirements based on your age, gender, height, and weight. Then we subtract 500 to 1,000 calories from that figure. And that's how we develop a meal plan for you. Your calories are distributed into carbs, proteins, and fats. 50 to 60% of calories should be carbs, 20 to 30% should be fat, and the remaining 10 to 20 should be from protein. The majority of your calorie or your carbs should be whole grains. Next thing I'm going to talk a little bit about is exercise. Very, very important, especially for your type 2 diabetics. It is the key. Exercise and weight loss is the key for your treatment. Exercise decreases blood glucose levels by increasing the uptake of the blood glucose into the tissues. The more you exercise, the more energy requirements that your cells need, and it promotes that uptake of that glucose out of your blood, thus reducing your blood glucose levels. It improves your circulation, lowers your your high blood pressure, and that in turn decreases your long-term cardiovascular problems. The next thing is pharmacological therapy. Insulin injections are a must for your type 1 diabetics because type 1, you have complete destruction of your pancreatic beta cells. So there is no way to mediate and control that besides taking insulin injections. We also give oral anti-diabetic medications like glucophage and metformin. These are not insulin. These are medications that actually stimulate what working beta cells you do have in your pancreas, stimulates them to secrete more insulin. Okay, but you got to be really careful with that, because if you continue that for too long a period of time, you can overwork the beta cells and what's called beta cell burnout. You will wear them out and they will quit functioning altogether, and you can become a very bad diabetic. So together, the oral anti-diabetic meds and your exercise will greatly reduce your chances of having to take insulin injections. That way, to maintain control. The last thing I'd like to talk about is education. We need to teach healthy eating, so that way we can help control our blood glucose levels with the foods we eat. Being active, what exercise is good for you? How do you exercise? When should you exercise? When shouldn't you exercise? When you do exercise, making sure you have forms of sugar on you. That way, if you exercise too much, your blood glucose could drop. If you have a form of sugar in like a candy, piece of hard candy, you can have that in your pocket and you can pop that in your mouth and get your sugar back up. Monitoring is another important thing. You need to know when you need to check your blood glucose levels. Importance of taking medication and administration times kind of coincides there with monitoring, but understanding what your medications are for and what they do is important. And reducing risks. Maintaining good skin care. We do not want infection. Any type of opening in the skin gives an opportunistic opportunity for infection, airborne infection, to invade the body. And with diabetics, their healing time is greatly increased compared to that of someone who has a normal functioning pancreas. Good oral hygiene is also important. Your mucous membranes in your mouth, same thing. Open sores in the mouth, very important to take good care of your gums. Proper shoes, inspecting your feet daily, washing your feet, making sure that they're not staying too moist between the toes, and on the other hand, make sure they're not staying too dry, where the skin can crack and break and let infection get in. So with education and management, we can now help individuals, patients that have diabetes, to help them live longer, healthier lives. And we just need to continue to do that so that we can help reduce costs of our healthcare costs. And it's just very important that we educate people. Thank you.